Clear some days, concerning on others, sometimes better once a medicine is removed. This uneven pattern is one of the strongest signals that the underlying problem may not be permanent. Families who keep even modest notes about when lapses happen and what substances were in use provide doctors with exactly the kind of information that distinguishes these patterns. It is not necessary to keep exhaustive journals. What clinicians value most are 3 concrete pieces of information: a current, accurate list of all medications and supplements, including over-the-counter items, the specific timing of when confusion or lapses began, and any recent changes in alcohol use or attempts to quit drinking. These details equip physicians and pharmacists to spot interactions, unintended side effects, or withdrawal effects that might otherwise be mistaken for degenerative disease. A neatly written list of pill names, doses, and behavior notes often illuminates patterns far faster than memory tests on their own. Consider Joan, who began forgetting where she parked only after starting a new blood pressure prescription. The clear timing pointed doctors toward the medication, and once it was adjusted, her memory gaps lessened significantly. Without that context, she may have carried a mistaken label of dementia for years. Frank, on the other hand, showed a slow erosion of language, problem-solving skills, and interest in activities over several years. The steady march across multiple brain functions, persisting even after medication changes, confirmed dementia rather than substances as the underlying cause. These contrasts illustrate how the same outward signs can point in different directions depending on history and trajectory. Families sometimes struggle most with managing their own worry. Watching a parent forget a familiar name or misplace items repeatedly is alarming, and fear of dementia often rushes to the front. But stepping back to connect lapses to timing is more useful than reacting in panic. Did the repetition start just after a sedative was prescribed? Did confusion spike after a few nights of drinking? Or does it occur regardless of outside factors, creeping steadily through everyday life? Families who ask these questions arm themselves with insights rather than assumptions. Doctors, for their part, can only see a snapshot during visits. Memory screenings may highlight impairment, but those tests cannot sort whether impairment is caused by progressive disease or a temporary influence without the broader context. That is why families' observations and written records hold so much weight. Shared timelines bridge the gap between what is visible in a clinic and how symptoms unfold at home. One practical reminder is that reversible causes are not rare. The proportion of dementia-like conditions linked to drugs or alcohol is small but significant, and it represents real opportunities for better outcomes. When families hand over clear medication lists, symptom timing, and alcohol histories, they directly support doctors in recognizing these opportunities. The result may be a safer prescription plan, advice on reducing intake, or guidance towards supervised detox if needed. Each of these can restore clarity in ways that otherwise might have been missed. Ultimately, the distinction between dementia and substance effects rests on watching for suddenness, looking for links to external triggers, and noting any tendency toward improvement once those triggers are removed. Families that adopt this simple framework help both themselves and their doctors avoid mislabeling reversible states as permanent disease. Instead of despair, the process opens the door to recovery for some and accurate diagnosis for others. But even with clear patterns, the next hurdle often lies in how these concerns are discussed at home. Families may discover connections between nightcaps, sleep aids, or new prescriptions and memory lapses, yet struggle with how to raise the issue. And while gathering information is one step, delivering it without conflict is another challenge entirely, especially when it touches on habits and choices that hold deep meaning for a loved one. Family conversations without conflict. Family conversations about habits tied to memory lapses often feel like the hardest part of dealing with substance-related symptoms. This is where emotions run strong, where words can land wrong, and where relationships can either strengthen or strain. Families often mean well, yet the way something is phrased decides whether the discussion opens a door or builds a wall. With sensitive topics like alcohol or prescriptions, success comes less from forceful arguments and more from subtle adjustments in approach. One of the simplest shifts is reframing blame. When the concern sounds directed at the person, defensiveness rises quickly. But when the focus is redirected toward the medications, the mixtures, or the chemical effects, the discussion feels less personal and more collaborative. Instead of saying, "You're forgetting everything," a calmer option is, "It seems like the medicine is making your memory fuzzy." The difference is small but powerful. Research confirms that collaborative language, where the problem is defined as external to the person, encourages openness, while accusatory framing makes change less likely. Tone also matters as much as the message itself. A sharp critique like, "You're not making sense lately," feels final and judging. A gentler observation such as, "I've noticed you seem tired in the evenings. I wonder if the medicine plays a part," leaves space for dialogue. Seniors want to preserve their autonomy, and they are far more willing to listen when conversations are framed around supporting that independence. Saying, "We want to help you keep driving safely," signals respect for what matters most to them, rather than highlighting deficits. Active listening is another key element. Many conversations collapse because family members arrive with a speech rather than a question. Instead, inviting the senior to describe their own experience creates space to share frustrations or side effects that may have gone unnoticed. Asking, "How do you feel the morning after taking that pill?" Or "Do you notice if your evenings feel foggier on some days than others?" makes the discussion interactive. This shift from lecture to dialogue keeps dignity intact and increases the chances of mutual problem solving. Humor can be useful, too, provided it respects the person. Light comments that shift blame onto tricky pill bottles or complex schedules help soften the mood. A joke about how those little tablets are sneakier than they look diffuses tension because it makes the situation the culprit rather than the senior. Families should avoid humor at the elder's expense, but observations about the messiness of managing. Multiple medications can bring laughter while keeping dignity in place. This sense of being all in it together works better than confrontation. Because these discussions can feel overwhelming, having a clear, simple checklist helps families remember what to emphasize and what to avoid. 4 steps are particularly effective. Lead by expressing concern for independence. We want you to keep cooking those meals you enjoy. Point to the substance, not the person the pills may be adding to the confusion. Ask gently about bringing a clinician or pharmacist into the conversation. Could we ask the doctor about this together? And offer to accompany them to the appointment. Would you like me to go with you? These phrases sound supportive rather than controlling, and families can rehearse them mentally before raising the topic. Research also highlights the importance of professional support in moving forward. Pharmacists, in particular, play a central role in reviewing medications. Evidence shows that pharmacist-led brown bag reviews often uncover duplications, interactions, or unnecessary prescriptions. Families who encourage seniors to schedule such a review by literally bringing every pill bottle to the doctor or pharmacist gain clarity and open the door to safer alternatives. Geriatricians also emphasize deprescribing, a thoughtful process of scaling down medications when possible. Encouraging loved ones to ask for a formal medication review provides credibility and reinforces that the conversation is about health and safety, not blame. Role-play style examples can help families practice. Instead of long stories, short sample lines are enough to demonstrate tone. A confrontational version might sound like, "Dad, your whiskey is ruining your memory." The cooperative version softens this. "Dad, I wonder if that nightcap and your medicine together are leaving you groggy. Should we ask the doctor?" In practice, The second version lands more gently because it points to the combination, not the individual. Short, practiced responses like these reduce the chance of arguments escalating in real time. Anticipating objections is crucial as well. Seniors often respond with, "I've been fine doing this for years." Meeting resistance with confrontation can escalate tensions, while acknowledging their perspective keeps the door open. Responding with, "That's true, you have managed it well. But since your prescriptions have changed, your body may be reacting differently," validates their history, yet still points toward the need for a new look. This balanced acknowledgement communicates respect for past successes, while framing the present issue as a new challenge. Another useful tactic is pacing. Expecting one conversation to resolve everything rarely works. Raising the issue gently, then letting time pass before bringing it up again, lowers defensiveness. Each time the concern is tied to a specific event, like a missed appointment or a confusing interaction, the connection feels more grounded. Over time, the repetition of these small reminders builds a pattern, helping the senior see the link themselves. Change is usually more sustainable when it is gradual and internally motivated rather than enforced from outside. Professional involvement also shields families from conflict fatigue. Sometimes, hearing the same advice directly from a doctor or pharmacist secures a breakthrough. Seniors may resist input from children, but respond differently when the recommendation comes from a trusted professional. Families can prepare by writing down concerns in advance for the appointment, ensuring the clinician has the full picture. This shifts the setting from a potentially charged home discussion to a neutral consultation room. Ultimately, the value of these conversations lies in maintaining trust. When families learn to reframe language, listen actively, and share responsibility with professionals, the dynamic changes from conflict to cooperation. Seniors sense that their dignity and independence remain central, while families feel relief in supporting without overstepping. The outcome is not just fewer arguments, but stronger relationships built on respect. In the real world, the tension often fades when both sides recognize they are not opponents, but allies against a shared challenge. The goal is not to catalog every forgotten item or habit, but to safeguard clarity, safety, and everyday freedoms. By treating medications and substances as the focus instead of placing blame, families create space for constructive solutions. Conversations that once ended in arguments instead become opportunities to adjust routines, explore safer options, and preserve quality of life. These approaches don't solve every problem, but they change the tone in meaningful ways. Instead of escalating disputes at the dinner table, families learn to talk in quieter, collaborative voices. Parents feel respected. Adult children feel heard. Both sides leave the conversation with the sense that independence and connection remain protected. And once family members are able to discuss these concerns without conflict, the next question naturally follows. What practical tools can help put these plans into action each day, keeping things steady and safe at home? Practical tools for medication management. Medication routines may look like small details, but they are one of the most important safeguards for protecting memory. The way pills are handled, organized, and monitored changes whether the brain functions with clarity or slips into repeated episodes of fog. Practical tools for medication management help prevent the subtle errors that so often get mistaken for serious decline. What matters is not only having the tools, but also using them in a consistent, structured way. A gold standard first step is the brown bag medication reconciliation. This process asks patients to gather every pill bottle, supplement, and over-the-counter product into one bag and bring them to a pharmacist or doctor. By laying out the entire list at once, professionals can check for drug duplications, unsafe interactions, or outdated prescriptions. Research shows that medication reconciliation, followed by deprescribing, carefully reducing unnecessary or overlapping drugs saves many seniors from spiraling confusion or falls. It is a simple habit with outsized benefits, one appointment where the whole picture comes into view. Families can help by setting a recurring reminder for these reviews, ideally every 3 months, since prescriptions change and risks increase over time. From that essential review, 3 clear steps make medication safer at home. First, collect everything into one place with a brown bag review. Second, ask the pharmacist about supports such as blister packs, calendar-style packs, or bottles that are easier to open if grip strength is an issue. Third, set up a straightforward system, either a weekly pill box, pharmacy-prepared blister packs, or reminder apps that alert when doses are due. These steps work in sequence. Clear the clutter, request the right packaging, then build daily routines. Most families find that following this progression transforms constant uncertainty into a steady, predictable pattern. Weekly pill boxes remain one of the simplest and most reliable helpers. Each compartment holds the exact pills for a day or time of day, so opening the Tuesday morning slot leaves no question about whether the dose has been taken. A senior juggling 7 or 8 prescriptions can replace scattered bottles with one visible container. This reduction cuts down on errors such as mixing a nighttime sedative with a morning blood pressure pill, mistakes that often produce grogginess, dizziness, or sudden memory gaps. The box clears that risk with one glance. Many older adults pride themselves on filling their organizer each week, a small task that affirms independence while preventing larger problems. Pharmacies extend this idea with blister packs, sealing doses into labeled slots divided by breakfast, lunch, dinner, or bedtime. They function like a calendar. Unopened means not yet taken, empty means completed. Families appreciate the accountability, especially in households where several people help with care. A quick visual check confirms exactly what has been taken without guesswork. For seniors, blister packs reduce the effort of sorting pills each week, shifting that responsibility back to the pharmacy and ensuring doses remain consistent. Technology provides a newer layer of protection. Many seniors and caregivers now use apps that buzz or speak reminders at set times. Some connect to relatives, sending an alert if a dose is missed. This extends independence while keeping family involved, especially for those who live at a distance. Coupled with pill boxes or blister packs, digital reminders create a second line of defense, confirming that the right medication is taken at the right time every day. The need for such systems becomes clearer when thinking about what happens without them. Medication mistakes have direct neurological consequences. Forgetting a dose of blood pressure pills may lead to fainting or confusion. Doubling a sedative by accident can produce hallucinations or a full day of disorientation. Families who see these episodes often assume dementia is worsening, unaware that a skipped or doubled dose caused the change. Structuring routine through organizers or apps prevents these avoidable missteps and spares both patients and families from unnecessary alarm. One common unsafe shortcut deserves attention: pouring every pill into a single container. Seniors who find childproof caps difficult may combine medications into one bottle, hoping to make them easier to access. The result is rows of look-alike tablets that blur into one another. Yellow pain pills may sit beside yellow morning tablets, and there is no clear record of how many doses are taken. It seems convenient, but research on drug safety consistently warns against it. The risk of doubling a dose or swallowing the wrong medication is far higher, and the error rate climbs quickly once pills are mixed. Pharmacists emphasize that the safer alternative is requesting easy-open bottles or pharmacy-provided packs instead of combining pills. Small details like packaging also significantly influence safety. Easy-open lids, larger print labels, or color-coded packs may seem trivial, but they allow seniors to stay independent without slipping into shortcuts that endanger health. Pharmacists generally provide these adjustments for free if asked, and families are often surprised to learn how much difference a simple change in packaging can make. The key is asking directly, something many avoid out of habit or modesty. Once requested, the changes sharply reduce the risks of errors tied to arthritis, vision problems, or cognitive fatigue. Consistency across days produces most of the benefits. When medications are taken on time, at the right dose, and without duplication, the body maintains a steady rhythm. Cognitive side effects become predictable, sudden drops or surges in alertness vanish, and overall brain clarity stabilizes. Doctors also gain more accurate health information. They no longer have to sort whether blood pressure swings are the body's fault or the result of erratic dosing. Families notice fewer panic calls in the evening and fewer emergency visits after preventable falls. The ripple effects are broader than memory alone. One mistake with pill management can create a chain reaction. Confusion leads to a fall, the fall leads to hospitalization, the hospital adds more medications, and the medication list grows more dangerous. Tools like pillboxes and blister packs stop that chain before it starts. They act as interruption points, keeping the first error from compounding into a cycle of new prescriptions, increased confusion, and lost independence.